Mark, thanks for being here today.
Hey, happy to be here, Mark. Thank you.
Great. As I was telling you just a few minutes ago, I did one of these before and I go, I'm very happy you're here. I'm trying to do a little bit better job of that. We're going to have fun today. And I was looking at your job description. And it's quite interesting. It's rather long. It says Director of Marketing and Clinical Education Recovery Sciences. I've never heard that long of a job description. Tell me what that really means.
Sure. It's been shortened a little bit, I think, in real life. When I came on board with Enovis in 2020, we were acquired. I was with the Light Force team. So I've been talking about high power lasers since 2017. When we got acquired, the portfolio was increased, asking me to start talking about shockwave and some of our electrical stim devices and traction, what have you. So it was fun to kind of have a little bit broader perspective. But we had a really small marketing team, so that with the nature of the corporate spirit of Enovis, I couldn't be in any type of sales role because of title and what I have to do on the education front. So I had to be into the marketing bucket, and we didn't really have a very big team at that time. So I've sort of had two hats that I was wearing with marketing and clinical education. Since then, they've brought in a lot of talent into our team that are serious marketers. And so they're handling a lot of the heavy lift on that. And now I'm mostly channeled in clinical education. So most of what I'm doing in my day job is to educate our sales team on how to go out and talk to our customers, educate our customers that have questions, and then people at shows and we're interfacing with as far as, how our technology can help them. And my marketing, contribution now is mostly on content. So I help with saying, hey, we want to put a piece together on, a topic. I help author some of that stuff and help with some of the content.
Cool. You are actually a physical therapist. You're not someone that just comes in and talks about sales, but you are a physical therapist. Tell me why you wanted to be a physical therapist. You can remember that far back.
Yeah, it was a while ago. So I have a doctorate in physical therapy, and I'm a board certified orthopedics clinical specialist. I treated for almost 20 years or so. Graduated back in 1999, so it was quite a while ago.
Yeah, a couple years ago.
Yeah, a couple of years ago. But I initially was talking to someone this morning about why I got into it. And initially, I thought I was going to go to medical school, and so I went through my undergraduate training, got a degree in exercise sports science from the University of Arizona, and thought medical school is going to be for me. Didn't know much about it. It just sounded good, and people nodded like, "Oh, that's great, Mark, sounds good." And so I was taking all the science classes, and was by the way it worked out, I was fortunate enough to date a girl that was in medical school. So she sort of showed me behind the curtain, like, this is what it's really all about. And by the time I got to the finish line of graduating, I didn't want to do it anymore, and it was like, oh, brother, what am I going to do? So short story was I went, licked my wounds a little bit, went back home, sort of recalibrated, lived in my parents' basement, worked some jobs. One of those jobs was a PT aide. While I was waiting tables, I figured, well, I better do something clinical, just to kind of do that. And was fortunate enough to work with a couple pretty talented therapists. And they were encouraging me like, hey, you should think about physical therapy. But I was like, I don't know, but there was one incident where this therapist had a very special set of manual skills. And there was a patient that came in doubled over with back pain. And, I was like, gosh, can you guys help me? And I'm looking at this guy. I'm like, boy, he really looks like he's in bad shape. And she did a couple push pulls and magic, and the guy stands up and, could walk out of there like looking like a different guy, and I was like, how did you do that? And she's like, oh, I studied at this school and I studied some specialty stuff with this guy. And, yeah, it's cool. And I was like, yeah, that's amazing. So I just sort of put that away. Ended up leaving there a few months later to get a full-time job with a buddy doing customer service work. And did that for almost a year and realized living in a cubicle, I was like, this isn't what I want to do. This is not where I see myself. So sort of started piecing together, what's interesting as far as a profession, and I realized there was just characteristics of, I like dealing with the public. I like interfacing. I'd been everything from a bank teller to a lifeguard to a waiter, and what I realized was like, it's fun to meet people, but you want to try to be interacting when people are there because they want to be, so if from a position of respect and sort of mutual, like, I'm here because I hear you can help me kind of thing, it's a different interaction as opposed to if you're, just, like as a bank teller, often people would be a little bossy or maybe even a little rude with you, which wasn't very fun. So I was like, I like the interaction with folks. And I like the idea of being able to have the entrepreneurial spirit of an outpatient type facility where you could work a sort of a 9 to 5 kind of life, not have to worry about hospitals and being tied down with the bureaucracy of a hospital system. So I started piecing that together, and it used pieces of my undergraduate education, which I liked. And it seemed like you'd get to help people, So you put all that in the pot. I was like, oh, maybe I will give it a shot. Maybe I could learn what that lady did, for that guy, because that was pretty cool. And so I applied to the school that she went to and was fortunate enough to get in, and was able to get the materials from the gentleman, Richard Jackson, which she'd learned all that stuff from, and sort of incorporated all that. And so I hit the ground when I was done with PT school, pretty advanced with my manual skills because of that. And was able to get quick effect with patients because of that, and started seeing a lot of low back patients and getting good results right out of the gate, which was a lot of fun. So it's a long answer, but I think the thing that got me interested is I just enjoyed problem solving. It was interesting to have people come in and say, hey, I'm hurting, or I've had this problem for weeks or months or even years, and nobody's been able to figure it out. It was fun to be able to help untie some of those things and help people get back to doing what they want to do.
That's cool. I talked to you yesterday, and we talked about the fact that you speak 2 different languages. And we're not talking about English and Japanese or Chinese or whatever. We're talking that you speak 2 languages, and the fact that you speak clinical and you speak business. And do you find that that's unusual with the profession? And number 2, do you believe it's important to be able to speak both those languages?
Yeah. I think there's a lot of therapists that are aspiring to get more into the business. It's not part of the curriculums. They don't tell you about how to hang your shingle out and do that. I think we had maybe 2 or 3 hours of business in our whole 3 years when I was in school. So it's a whole, I think on the chiropractic side of the ledger, they get a little bit more of that. Even talking to those folks, they're like, yeah, you don't get enough. But it's sort of expected that when a chiropractor comes out of school, they're going to probably open their own practice or go work for somebody, but eventually aspire to that. In PT, there's a lot of different avenues that people can go, whether it's hospital-based or rehab-based or outpatient. And so it's not clear cut that everybody's going to need that training, which is why they probably don't do it. But it's certainly important, and there's most people that are in the business side of things, they've learned it from the school of hard knocks. I guess I sort of did too. I was a part owner in a clinic. Didn't know much about it, but luckily had a corporate entity with some business guys that could help me with the leases and staffing and all those things that I didn't know much about. Then as you get to learn more and more about that, you can sort of see, oh, okay, that's how that works. Insurances and contracts and things of that nature. But I was fortunate enough to be involved with some good folks, and like I said, they sort of mentored me. I left being a private practice owner. We sold that practice due to some headwinds that we couldn't overcome to a physician-owned group. So I was able to keep my staff, stay in the same building, but basically just hand the keys over to another group. Did that for about 3 years, and the only thing that changed was our reimbursement improved because we went underneath their contract. So I saw how that worked. I was like, well, that's easier. Our clinic just got a 30% raise for doing nothing but filing differently. They sold that practice 3 years later to a hospital group in Southern California. And so it was part of an ACO type of merger. And I got to sort of see how that worked. And the flavor of things changed a bit, and the patient makeup changed. So I decided it was time to leave that. And I went to work with a friend in Middle Tennessee, Nashville area, excuse me, who had a company that he was one of the C-suite gentlemen of. And they had about 25, 26 clinics, and they were trying to grow it. So I thought that would be the next challenge. Let me get a feel for, multi-site operations and management. So I learned a lot about that to see from a corporate side how that is done and how you look at productivity and profitability and, doing it from the scale of multiple clinics versus just a single shop. So gives you a lot of different perspective and understand, how that works and the metrics that people are looking for. It's a challenge for the clinicians because, they usually get into this profession because they want to help people, and they'll usually give you the shirt off their back. So, when you start talking to them about how their billing is and how they have to see X number of people in order to, meet their productivity standards, those are usually not love language, terms with those folks,
Right.
Which can be a challenge. So knowing how to balance all of that on a clinical message on, why people are doing it and showing them ways to get their skill set better so they can help people better and tie that into improved metrics so that they're helping you keep the lights on. That's sort of the art, because if you're just talking about the business, if somebody comes in in a corporate setting that has no PT background and just comes in and knows how to be an operations person, they tend to not be very effective with healthcare folks because they don't know how to speak that same language, and they can't help them problem solve how to do a better job to improve their metrics.
Right.
So it's not as easy as looking at a spreadsheet and going, wow, you don't see as many people as your coworker does. Why? They usually don't know why. They're like, oh, I'm just trying to do the best job I can, and I'm trying to give the best care I can, but maybe their best isn't the best. Right. So you have to help them see that.
It seems like there are, and you've been in each one of these areas. You've been a practitioner. You've actually managed other practitioners. You've been an owner. So those are three different kinds of things. And we're talking to all three of those people. But the thing that disturbed me the most as I've gotten in this is to see how many physical therapists or practitioners they're getting out of the business.
Mm-hmm.
Would it be true to say that is it more because they aren't good clinicians, or is it they don't have the ability to mix the two, the business and the clinical together? Or is it just business alone? I'm just curious.
Well, there's a few things to unpack there. I think the environment is very important. So, if you come out of school, the way it works is you have a couple long-term affiliations, and there's usually 8 weeks or maybe even a little bit longer now in some schools, but you get 3 of these things, and usually they're in different settings, and that's supposed to be your clinical training, right? Well, if you're unfortunate enough to have bad clinical experiences when you're a student and you don't get, maybe you're with somebody who's burnt out themselves and don't give you the time of day and you don't get a great clinical experience, that can significantly impact your skill set. So now you're behind the 8 ball because you're now going to come out of school and you're going to demand a salary that's going to demand a certain amount of, patient volume. And you could be drowning pretty quickly because say maybe you don't have the manual skills or you don't have your processes down to the point where you can efficiently treat 12 people in a day. So it can become one of those situations where you feel like the waves are crashing on your head because you're like, gosh, I can't see this many people. I'm not getting anybody better. And I'm just scrambling to keep myself together. I had a fortunate enough to have a mentor when I was in one of those rotations, and I was trying to see more patients. I was like, why don't let me see 4 or 5 people a day? I want to see more. And he's like, don't worry about the volume. He's like, if you were to start trying to see a bunch of people right now, he goes, you would only do what you're good at. And he goes, right now as a student, that's a pretty short list. And he said, the smartest thing you can do is just work on these techniques we're talking about and take your time to learn how to do these things better so that your skill set will grow and it will eventually make it a lot easier to see more people. He goes, there'll always be that chance to do that. But right now it's not the time to focus on that. And it was really sage advice because it helped me understand, he was right. I need to get better at doing these different things that can help address joint problems or more complex soft tissue problems so that you can do it more efficiently. Because that's the name of the game, is that you have to be able to assess very quickly, see what the problem is, connect with your patient, know how to engage quickly, but get to it. Say, okay, here seems to be the problem list, and here's how I'm going to get it better, and explain that to the patient, get them on board, and then do it. Because you don't have time to, to mess around. If you do, then you're going to be falling way behind. So in a roundabout way, I think a lot of times people will point to the burnout that's going on. I think 23% of therapists right now say that they're burnout. I think after the last stat I saw right after COVID, 2022 stats, I think over 22% of therapists left their job. And right now, I think there's a 2,500 therapist shortage in the United States. So staffing's a big problem, and everybody's going, well, everybody's burnt out, they're running too hard, and, the sky is falling. I think it's you can look at a leading metric versus a trailing metric. And I mean, all those things of people falling away are trailing metrics. The leading metric, I think, is that clinicians got into it because they want to get people better. And they're looking for a skill set or tools to get people better. and they might just not know about it yet, or they're not skilled enough yet to really do it. But the fuel for most therapists is having patients say, hey, you help me.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Torrentia Medical Education.
Torrentia was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Torrentia Tribe, you can also check out some of our events on our events page at torrentia.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.